Inhalers can cost between $50 to $300 per month. That can be very costly, especially if you have more than one child that you're treating. And then think about the fact that you usually would want one inhaler to stay at school, and then you'd want one at home, and then you'd want one at grandma's when she's watching the kids. You know what I mean? So they can get very costly.
Hello and welcome to the Hi-Fi Health News Podcast. I'm Erika Grotto. Today we're going to be talking about two health conditions that often go hand in hand: asthma and allergies. Millions of Americans are affected by one or both of these conditions, and managing them can be costly, from medications to doctor visits to emergency care and lost productivity. Joining me is Dr. Renee, a media medical personality who also hosts the podcast Black Doctors Speak. So before we get started, could you tell the audience a little bit about your experience and what you do?
I am Dr. Renee. I'm a medical doctor. I don't practice traditional medicine. I actually talk about health and wellness and medicine in the media. So TV, radio, print, and online media. You might have seen me in your doctor's office waiting rooms. My current show is called Keeping It 100. And also, I believe they're still airing My Patient Journey, which actually talks about my asthma.
Let's get into allergies and asthma. What got you interested, besides maybe your own experience, or was that it, of talking about that topic in particular?
So that is exactly it. It was my experience, and finally listening to people, because everyone swore, your first book needs to be about asthma and allergies. And I was like, why would I write about that? And then I joined a bunch of Facebook groups on, and I really noticed that perhaps I should write a book about allergies and asthma, because I was realizing that those parents were doing things very differently than my parents did. And I knew, because 49 years old, I knew that the way my parents did things really worked very well. And when I say that, it was a lot of kids that really were growing up in a bubble, to the point that I didn't know how they were going to leave the home. And so, but I knew that my mom and dad, I've been able to live overseas. I traveled as a child, even with them, but then as an adult, and all these different things. I've lived in other countries, and obviously I had to eat while I was there, and I have severe food allergies, and I have asthma, and I, knock on wood, I've never gotten sick when I was away. So I figured maybe I could shine a light, and that might give some parents some, information that they didn't have. And then I wrote the children's book, because bullying with allergies, food allergies in particular, has become a huge problem, unfortunately. And I figured if I write a children's book about it, then maybe that could help those kids become really great, amazing teenagers, and they wouldn't do that.
I read this morning that depending on who you ask, between 50 and 100 million people, which is a big difference, but lots of people in this country suffer from allergies and or asthma. And when it comes to allergies and probably even asthma, it can be something that is annoying, or it can be something that is life-threatening. And there are allergies to all kinds of different things. It's, sometimes it's easy to avoid the thing you're allergic to, sometimes more difficult. So that's why I wanted to dig into this a little bit, because whether it is a nuisance or a life-threatening issue, it's something that you have to deal with, and there are financial decisions that you need to make. So when you and I talked before the recording, you were telling me about some of the things that are and are not covered by insurance that you might need for treatment. Can you talk a little bit about some of those things?
Yes, definitely. So one of the biggest things right now in this country, and I think I mentioned it to you also, was that the step therapy. So there might be this really amazing drug that we know it's going to work, but because insurance will only cover because of step therapy, so that basically means that if step 3 drug is the one that works, your insurance is not going to cover number 3 until you have went through I don't know how many cycles, months, or whatever of step one, and then step two. And then finally, we get to the one we really wanted. And so that is a huge problem. I have actually advocated in DC for the last 2 years, which is why I don't like politics because stuff takes too long. But for the last 2 years, trying to get that changed because that's unfair. If the doctor knows that this is what works, then why do I have to be the guinea pig and we have to go through 1 and 2 when we know 3 works? So why do I have to live miserably? And I always say, if you've never had a problem with breathing, then you don't know how awful and miserable it can be to not be able to breathe. So why do we have to do that? It's just the silliest thing. So that's the first thing with insurance that drives me completely insane. And usually, of course, that happens to people who have, who are underinsured or don't have any insurance. They're the ones that really are suffering. I have a PPO, and whatever drug I want, I can either it gets covered or I can afford the copay. So that's not me, but it's a lot of people that's affecting, and that's awful. Then, of course, you have inhalers can cost between $50 to $300 per month. That can be very costly, especially if you have more than one child that you're treating. And then think about the fact that you usually would want one inhaler to stay at school, and then you want one at home, and then you want one at grandma's when she's watching the kids. You know what I mean? So they can get very costly. And then now we have all this new biologic therapy, which is amazing because it works really, really great. The problem is they are really expensive. And unfortunately, for the underinsured and the uninsured, it's almost like a pipe dream. Like they're just never going to be able to afford those. And those, they say cost over $30,000 a year.
One example that I thought of, because it's something in my life, is the EpiPen.
Yeah.
My daughter has a prescription for an EpiPen, and just like you said, we need one at home, one at school. My daughter has a food allergy. She has very little chance taking her lunch to school, and her teachers are aware and all of those things. She has very little chance of eating the food that she's allergic to. And so there is a decision there of like, she's probably going to be okay. Do I really need to do this? And I'm a parent of a young child, so of course I'm going to pay for the EpiPen, whatever it's going to cost me. But it's not cost prohibitive for me. For others,
Right.
It might be, or it might not be fully covered by insurance. And that's a tough situation to be in, where you're having to make a decision between, well, I'm probably not going to need this, so is it a waste of money to fill this? Or if I do need it and I don't have it, it could be a fatal situation.
Exactly. And especially, well, once again, when you say you have multiple children that are at 2 different schools, it's like you're picking which one is going to get it and which one's not. EpiPens, as most people know, I think it was in the pandemic, they went up to like $600 a piece, which was just insane. And then, as you know, usually you do it in pairs because the first time may not be enough and you might need a second one if you're having a reaction. So that's 2 times 4 now. So 2 at school and 2 at home. And so yeah, that is just insane and awful. And it's not a surprise to me now that I've met so many people that are underinsured and uninsured that do not have them.
That's a scary thing.
It's scary, and it also explains why I discovered that in the Black community, there still are a lot of deaths due to allergies because they don't have what they need. And so, relying on getting to the hospital on time is that's just not a good backup plan. The backup plan is you do the epi and then you go. And so it's unfortunate, but it makes sense. I mean, if you don't have an EpiPen and have never had one, yeah.
Yeah. And getting to the hospital presents yet another financial challenge, because we know a lot of people avoid getting care, even emergency care, because they're afraid of what it's going to cost.
Yes.
So let's get into that a little bit about, ED visits and that's another thing, not just the cost of the visit, but I've got to go to the hospital right now, but I have to work. And if I don't work, I don't make money.
Right.
That's a financial decision people need to make as well.
Right. So single trip to the hospital to the ED could be $1,000 to $3,000. So that's just being treated at the ED. And like you said, a day's work of wages, a day's work of wages for mom and dad, maybe, if this is a child we're talking about. That can be a big hit. Also, the day's work of wages for mom and dad. And then, you can't have other children at the hospital with you. So who's taking care of them while you're at the hospital with your child? And if anybody in this day and age knows, especially when it comes to children, and I think adults as well, you can't just drop people off at the hospital. You have to stay there.
Yeah.
You have to be on it. You have to advocate for them, particularly if somebody can't breathe or can't, if they're an older person, they can't, speak for themselves. You have to be there. So God only knows how many days of daycare, of, babysitting or something you might have to endure, or missing work and stuff. So it can be very, very, very costly.
Yeah, absolutely. Now let's talk about some of the other hidden costs. There are, for maybe more of the nuisance allergies, there's over-the-counter medications, but that can add up, especially if you're taking it all the time. What are some of the other costs associated with allergies and asthma that might not necessarily be things that you think about first thing?
Well, I think that lost work days and school absences is a big one. I think people don't realize how difficult it is to function if you cannot breathe, or if your environment you're going into is what you're allergic to. Think about all these old school buildings. I mean, besides asbestos, as we hear on TV all the time, all of that mold and mildew of these old buildings that probably need to be torn down and don't need to house children during the day, or the adults either, because let's think about it, the teachers might be just as sick as the kids. A lot of people with asthma and allergies miss a lot of work in school because of it could be just walking out your door. You can't even get in the car or get on the bus because of what's going on in the air. And so I think people don't think about that. And then, like you said, the over-the-counter medications and the supplies. So, a lot of these medications, especially for asthma, there's all sorts of contraptions that go with taking care of that. People with allergies often have to have humidifiers in their homes, air cleaners in their homes.
Got one.
Right. And our house, because my dad was a HVAC person anyway, we had a special humidifier on the furnace that was a part of the system. There was a special air cleaner, something with the vents and the air conditioning. So our house was it's probably got the best air in the world because of that. But all of those things, that stuff costs money. And if you're renting, I don't know how you explain this to your landlord, but, I had a friend that had black mold in her rental that she was renting, and she didn't realize it. It was in her basement, and I forgot how she found out, but it triggered her asthma so badly she ended up hospitalized. This is a single person. So you can imagine, just like you said, you don't work, you don't get paid, and she's single. So it's not like there was, another person to help her with her bills. And she was hospitalized for multiple, days. So, that's awful. And then think about transportation. It's not always easy for folks to get to and from, but I can tell you, for me, my first 10 years of my life, I spent every night of April and October in the ER. Thankfully, my parents had a car to get me there. But if I lived somewhere else and I had different parents, then maybe they couldn't afford to get me there. Or think about how much, because when we went to this ER, there was no paying to park. It was no big deal. Nowadays, I know people that have, they have to decide, because paying to park at some of these hospitals is a whole lot of money and very, very costly. And so it's like, okay, how do I get to the hospital the fastest? But at the same time, I can't afford to park the car there for multiple days or whatever it is, hours, and then, mental health toll, and then you got to pay for that therapy.
Let's talk about other options that people might have, or programs that could help people, because obviously what we want is people going in for the care they need.
Yes.
We want you to have all the inhalers that you need in every place you need them, the EpiPens, all of those things. But when there is a financial barrier, are there programs that can help people?
Definitely. So I always suggest go to the manufacturer's website. Go to the manufacturer's website because they themselves have a lot of programs that will take the cost down tremendously. If it's a discount card or if it's some sort of grant, but a lot of the manufacturers for these different drugs will have their own program. And then outside of that, they might be able to lead you to someplace else. But then if you go to different websites for your condition, allergies, just Google allergies and nonprofits and then see what resources they have. AllergyAsthmaNetwork.org has a ton of resources on their website when it comes to this. And if you go there, you should be able to find just about everything you're looking for when it comes to allergies and asthma, but they have a ton of resources. And I mean, that goes with any condition. Just Google and try and find the nonprofit and then, nonprofits in your area and start asking questions and talk to your doctor. And before you leave the doctor, please tell them, because the last thing as a physician I know that we do not want is for you to leave knowing that you can't afford the medication. So just say something, because you don't know if by chance, although I will tell you in the year of 2025, I hate to say it, but samples do not seem to be as common as they were back in the day. But the farm reps used to always give samples. So there used to be samples. So then the doctor could help you out that way. But all they can say is, no, I don't have any. So ask, say, I'm going to have a little trouble filling this prescription. Do you have any samples? And if they don't, they may not. But then say, okay, so do you have an alternative medication that's cheaper? Or do you know of any programs, or can you guide me somewhere? Because oftentimes you weren't the first patient with this problem. So therefore, they've already investigated, or somebody in the office has investigated and figured out a solution. But if you don't say anything, they have no idea. And doctors are not going to assume. And actually, I think I'd prefer that they not assume that somebody's in whatever financial situation they're in, because that would be discriminatory. So therefore, you need to speak up and say, okay, this is going to be a bind for my family, blah, blah, blah. The other thing, like we mentioned with multiple inhalers and stuff, please tell them this is the situation. Johnny's dad and I are not together. So therefore, we need him to have medication at his house as well as mine. But if you don't tell the doctor, how are they going to know? So you have to speak up and say these things. And a lot of the doctors, they've been in practice a long time. They know the tricks of the trade when it comes to the insurance, and they know how to make sure that you're able to get all of this medication that you need through the insurance, legitimately through the insurance. So please make sure you speak up. But like I said, the first thing is say something to the doctor. And the next thing is to go to your manufacturer's website and say, Google, and you can ask the doctor. If you don't know who the manufacturer is, ask the doctor. They probably know. And you can Google and look it up and then figure out what programs they have, because oftentimes they don't have to charge that amount. They do have a way to make it cheaper.
Well, you've given people a lot to think about here. I think the message is definitely get that care you need. There are tools available. Dr. Renee, thank you so much for joining me today.
You're welcome. Thank you so much for having me.
All right, that's it for us today. I'm Erika Grotto for Hi-Fi Health News. Thanks for watching.